feel like, especially for new grads, when I feel like labs is a huge thing.
Yeah,
When you're a new grad, it was for me. And COVID,
totally.
I remember COVID, like in like the first month in, our CMO called each one of us individually to give us like a pep talk and
Oh my
to
God, that's
like
really sweet.
get us ready for like pandemic mode. And it was
Wait,
teaching
so the
us,
one, sorry, not to give it specific names, but the CMO that we all had
yeah,
that is now not
yeah,
there anymore. Oh my
yes.
God. That
It
must have
was
been really sweet.
lovely.
Yeah.
I loved it. Like it was a very supportive conversation
Oh,
and it was
he's really good at that.
ask yeah, and it was asking, okay, like this was the height of things and
Mhm.
we shut down, we went to full telehealth and he was like, "What are you going to send someone to the health center for?"
Well, hey there, it's Liz Rohr from Real World NP, and you are watching the Real World NP YouTube channel. We make weekly episodes to help save you time, frustration, and help you take the best care of your patients.
Hey, so I have a really, really fun episode to share with you. So I was having a conversation with two of my really good friends, really good nurse practitioner friends. We all started at the same federally qualified health center together back in 2015, 2016. And I just thought it would be super fun. So I have this podcast. It's called That's Not How That Works. It's by Weeze Duran. Weeze is an amazing human. You should definitely check out her work if you are not familiar with it. But she has a podcast that talks about things like equity and liberation. But what she does is that it's herself and her colleague who also works in the equity space. And they come together and they have this podcast, and it's literally just them having conversations that are recorded and then it's shared as a podcast. And it's like, it's so impactful as a listener. And yet for her, it's just shop talk, basically. And so I just had that idea of like, oh my gosh, that would just be so fun to be able to have recorded conversations of other nurse practitioners and myself. And especially because the two nurse practitioners are Kara and Heather, and they are both adult Gero nurse practitioners. Kara also is a women's health nurse practitioner, that's her other training of her degree. And yeah, we all started together. And so my thought was is that I wanted to, Kara had the suggestion of coming on and sharing funny stories and are just like adding some sort of levity, because I just really feel like that's what's called for in this moment. And it went kind of all over the place, but I feel like it's a really special share. What we really talked about, definitely have some stories and a content warning, depending on your level of comfort. We talk a little bit about patient stories with some not super gruesome details, but some clinical details, and that include things like blood and stuff like that. So just so you know, that's like towards the end of the episode, and I say content warning before we start getting into that if that's not your vibe. But yeah, so we kind of talked about like our experience together, being new grads together, what it was like, what insights and pearls that they have, especially because we've all gone from brand new grads, 7+ years ago into various leadership positions. So I have real world MP. Kara is a medical director. Heather is also medical director. She has a different role now, but it's just, I just really want to share this conversation with you, whether you're a new grad or you are an experienced person in primary care, or if you're coming from a specialty back into primary care or into primary care for the first time. I think it's just really fun to have community and have levity, because right now it's just things in the world feel a little bit intense, and they have for a long time. So I just thought it would be super fun, because I also feel like community is one of the things that I feel like is lacking, at least from my kind of experience of the profession, from my where I've been in the profession, right? And my experience in real life. And maybe that's not your experience, in which case I'm so happy for you, because community is so important and not being isolated is so important. So yeah, so hopefully you enjoy this episode. I don't know, it's just kind of like, I am nosy, and you may have heard this before, but I am super super nosy. It's kind of just like eavesdropping on like a really beautiful conversation. So yeah, I hope you enjoy it. So I wanted to add, one of the things I'm trying to bring to the podcast this season and going forward is just a lot more humanity. Like I just want to have more authenticity, more humanity, more like real life, right? Because the whole point of this company is that real world NP, it's like the difference between grad school and the real world. But the other thing that's really evolving is that it's just important that we all just get to be regular people. And I mentioned this in the recording, but I'm a little bit spicier in real life, I think, than I let myself come through here. And so there is some language. If you have kiddos or little ones around you, just maybe putting on some earbuds, just knowing that that's going on. It's not too explicit, but I just want to give that disclaimer in case there's anybody around or you're listening in the clinic or something like that. But I really hope you enjoyed this episode, and I would adore to have them back. We'll see. We'll see what happens. But yeah, without further ado, here's the episode. And just to let you know, this episode is going to be wrapping up this season. We're going to take a brief holiday pause. And then in the new year, we have a whole bunch of other episodes to share, including a number of beautiful interviews, some of that have already been recorded and some that are due to be recorded. So FYI, we're taking a little pause, but we'll be back real soon. So we were just saying before we started recording that we fucking miss each other. Excuse my language. I might actually bleep that out on the real podcast. We'll see. Use whatever language you want. This is a new season. This is a new
Just
Real
keep it
World
so
vibe.
appropriate.
It's a new season.
It feels like it's appropriate for the new season.
I mean, honestly, with COVID, like life is weird. Life is just become very weird. So
it really is weird. And everyone's burnt out. So
right. Maybe
we're all just saying fuck it.
Yeah, pretty much. So yeah, what's going on? Like, there's so many places I want to go, and like I don't know where to jump in because like I want to know what's going on right now, but like nobody listening is going to be listening to this knows all of y'all and our story.
I know.
So I don't know. Maybe start with like we worked together and we miss it a lot.
Yes.
Yes.
And we worked together on FQHC.
Yes. So back in what year is that? 2015? I think it was 2015. I started in 2015.
2015. Yeah. That's when
you started in 2015 and you were at Salem. Well,
yeah. So I was precepting
work,
in 2015 when you started in Gloucester.
Oh yeah.
But I met you right when you started, and then I started the beginning of 2016.
Oh my gosh. Oh, that's so right. I totally forgot about that. And Kara, when did you start? You started in 2015.
Time
doesn't exist anymore. Time is not real.
A few months after me. So sometime in 2016.
I think it was 2016. Yes. 7 years. 7 years. Yes.
Isn't that crazy? Oh my gosh. And so we all worked in a federally qualified health center, which I don't know about y'all, but like for me, I was like on the hunt for a community health center, and I was just like, bam, like magical, amazing dream job. And it was something. It was something. Well, I guess, so we all worked in FQHC together. That was in 2015, 2016. And then I think we all kind of went different ways over the last couple of years. And so maybe what are y'all doing right now? Maybe if y'all want to share, what kind of work do you do right now? You're what kind of nurse practitioner you are, what kind of work you do.
You want to start, Kara?
I'll start. Yes.
Okay.
Right. So 2016, I got to meet Liz Rohr at a federally qualified health center, my first NP job.
Oh my God, I might cry. Sorry, I'm not trying to interrupt you, but I'm just like, I'm so emotional hearing about this. Oh.
Well, what is amazing for me and feels like a full circle moment right now is that, so I've been at the same health center for 7 years, and my first NP job, and for people who are listening, I get to have my first NP job with Liz Rohr, and I get to start as a brand new nurse practitioner at a health center and have a mentor there. Like, that is absolutely amazing. So I've been here for 7 years, and just a few months ago, I started as our director of clinical training. So this is that like full circle moment coming back. So the main role for me now is I'm a half-time PCP, and then the other half-time, I am going to figure out a way for us to standardize how we support new grads and people with less than 2 years experience. So talking with you today. Yeah, right?
Wild.
Like, and everybody, like, just to have the love continue pouring out, right, is everybody who joins the health center. And I said, okay, do you know Liz? Do you have Real World NP?
Oh.
And they're all like, yeah, I do that. And I'm all like trying to share resources. And this is who like,
everyone is the same.
I already do that.
Well, I follow this person. I'm like,
well, that's like really reassuring because I actually went to a conference. I don't know if I told y'all, but I went to a couple of different conferences, and I had a table at one of them last year, and people were like, so what's this Real World NP stuff? And I was like, oh, not that I needed to be a thing, but I was just like, how can you not, like, I just need all the people to know. I need all the people to know.
Yes.
But yeah, I'm so glad to hear that.
I feel like all the people I meet do know.
Yeah.
Maybe it's a Massachusetts
like,
thing.
yeah, you know her. Yeah. It gets me so excited. I love it.
Oh, I'm so happy. Kara, I'm just like we're all peers, and yet like I just have so much pride for, I mean, both of you, but like, oh my gosh, I'm just like so proud of you, like seeing where this is just going to be like a love fest, this whole thing. But I'm just so proud of you. Like, it's so, so cool to see you where you are and like just taking on that boss role. Like it's a big jump going from, brand new clinician, experienced clinician, and then leading the people and having some tough talks and real talk and
real world NP life. That's the deal, right? That's what I'm saying.
And I love that role for you, Kara.
So
I think
good.
that's going to be awesome.
I feel very excited. And right now we are in this super transition space, and we have 3 new grads coming on board very soon. Super excited. And
so
what an
good.
opportunity to get this right.
Oh my
Right.
God,
And to carry on what I got to learn from both of you and remembering what that felt like to start with other people who were new in practice and how I hope to like foster with them to give them space where they can be together and actually build that into their schedules, right? Like if we can build in proper support, right? Like that's the dream. So
I love that. Oh my God, so many chills. I love it so much. And I'm wondering, I think before, and again, you don't have to disclose any sort of personal things. This is on the internet, or will be on the internet. I'm wondering about, I remember before, so since I left the health center that we worked at together, like there was a residency program that was in progress. Like, is that still going on? Is that part of it? Is it this is separate?
We moved away from that. And I think it's like, we need to create a culture of sustainability. And we had that program and it was lovely, but I don't think that we had the right amount of staff to do it well, right? Like we were asking people to run that program who were doing a bajillion other things and didn't, which it is amazing. And they did a great job. And it was also really stressful. Like it wasn't well supported. So now I feel like we've moved away. Maybe hopefully we can move back. But a couple of our folks that are coming on new just went to a residency program. So it'll be nice to hear what people think.
I understand. So they went through a program and then now they're starting their first job after a program. That's amazing.
Yeah.
So the other thing with the residency program was that we were no longer allowed to take students once.
Right. Because Heather, you were there when the residency started, because I was not there at all at that time. Oh, that's really hard.
And we had a lot of employees that started as students. Right. So
God, yeah.
I think that sort of took away from us getting some of those new grads on board that we knew had the experience with our EMR and in community health. Because there was a period of time we weren't even hiring new grads.
Yeah.
It was just like through the residency program, or they had to have a certain amount of experience. And I think that was probably not the best direction to go in. So I think now I'm not sure, Kara, but I think maybe they'll be taking students again.
Yes. Hopefully. We have 3 nurses at our health center who are all in NP school. And
the best.
That's an amazing sound.
Yes.
That's so satisfying.
It is amazing because I get to start precepting someone in a couple of weeks who is our endocrine nurse. And then we have 2 other, like a nurse manager and somebody who is currently doing school-based health, like with us too. So we get to do their precepting, which is lovely.
That is awesome.
Yeah.
That is so exciting. And Heather, so you started around when we started, and tell us about your experience. You're a different place right now, but
I am. Yeah. So
I'm also extremely proud of you. And I'm like, so sorry, I'm not going to interrupt you. Go ahead.
I jumped around from each site initially, right? Like I started covering maternity leaves and I went to every site. And
as a new grad, you did that, right? You were like a coverage. Yeah. Oh, I forgot about that.
And then, so the FQHC that we worked at had 3 different sites. So, then I got to move to the same site as you guys. And I was so excited.
That was so great. Oh my
gosh.
I was
so excited.
I forgot that. I know. It was like, we have another person, but I just want to keep her.
I know.
All the new people. Do you remember Christina? Do you remember well, obviously 2 Christinas,
but Christinas? Yes.
Not Christinas, but the Christina that started with me.
Yes.
I haven't talked to her in a while. I'll have to chat with her, but yeah, that was just so fun. There was like a whole bunch of us. I think it was us 4 with the main new grads for a while.
And Ryan.
Until we had, and what?
Ryan.
Oh my God. Talk to Ryan. I was just thinking of him. Oh, so funny. I totally forgot about that.
And we had a new grad physician. We had Dr. Dono too, right? Like
yeah.
we were,
Yes, she started the same day I did. It was her right out of attending, becoming an attending, and then me and Christina, and then the rest of the people. Yeah. So I think Ryan started after you, right?
Yeah. But we were just like all in it together. Like,
I know.
let's do this. This is what we need. Like,
oh, it's so good. And then you came to our site, and then and like you also became a boss lady.
Yeah.
Right?
So
I mean, boss,
I
I don't
became an
just you
associate
were the
medical
boss.
director.
Yes.
And then right before I left, I became the medical director, but the timing just wasn't it for me. So I had already started applying other places before I was not before I was offered the role, but once I took it, and then I started getting offers right after that. So I ended up moving on, mostly because I had my third baby and I just needed a better work-life balance.
Totally.
It was like too much for me with renovating a home and trying to raise 3 little kids. So
oh my gosh.
I'm doing house calls now.
So cool.
With a wonderful company, and I am so far enjoying it. I mean, the work-life balance is definitely there. It's a world of difference. So
I love that. Oh, that is so
still
cool.
new to me. I'm still learning the EMR and like in the figuring it out phase, but it's going well.
I love that. What kind of things do you see?
Oh, like the average age of my patient is probably 90.
Yeah. Wow. My goodness.
It's like,
I was gonna say Jerry is your thing.
And
Jerry is like
90. Wait, who said 90? I'm sorry. I just processed that.
I know. I'm still processing it.
That's amazing.
So I do miss adults though. Like I feel like we had at least 2 solid years of like 80% of our visits being like adult mental health.
Oh my gosh.
And it was
since COVID, you mean?
Yeah. And it was, like exhausting, but also rewarding. And also like, you just learned it very well. So
you mean mental health?
I started to know that space very well. Yeah. Mental health.
Yeah.
And, not so much Jerry. So here I am relearning all things geriatrics.
I love it. Well, I just remember, I think around when we first started, or maybe like during those years, I feel like I was like, what would your like ideal patient situation be? And you were like,
I love geriatrics.
Well, like a SNF or an LTAC, or sorry, a skilled nursing facility or a long-term acute care. I was like, oh, that's it. You're
like, huh? That sounds terrible. I loved it. And now it's like a lot of hospital follow-ups. So we're like seeing the patients in their home because they're getting into the office.
I love that. What kind of stuff are they following up for? Like pneumonia or
falls? They went to the hospital for.
Yeah. So, like all
pneumonias, falls, CHF exacerbation.
I'm so glad there are people who
they're all super complicated because they're 90. So by then you have a world of chronic diseases.
Yeah.
But I don't know. I'm enjoying it so far. So hopefully it continues.
That's awesome. I love that. Oh my gosh. So I guess we're just kind of going off the cuff here. I guess the thing that's coming to me that I'm wondering about. So like, obviously, like I really miss working with y'all, and I'm wondering what it was like for you. Yeah, like since the pandemic, and I don't know. I mean, I think so. I've made a couple of episodes already for this podcast season. I can't remember when this one's going to come out, if it's before the new year or after, but talking about, I just feel like things have really changed. And like when I started Real World NP, I was just like, yeah, like this is how the profession is going. And it just felt so different. And I just feel like COVID hit, and I don't know, I'm feeling a little disoriented still. Like, I just feel like, I don't know, what has it been like for you? So before we started recording, it was kind of just like, well, I mean, maybe at the beginning of the recording, you said that, Heather, everyone's kind of burnt out, but what's going on? What has it been like for you? And what has it been like? Where are you at now? I think we've all talked a lot about burnout and reevaluation, and I don't know. What do you want to share? What do you want to share with the people thinking about the new grads? You know, Kara, you've gotten all those new people coming and
Yes.
yeah.
I feel like, especially for new grads, when I feel like labs is a huge thing
Yeah.
when you're a new grad. It was for me. And COVID,
Totally.
I remember COVID, like in like the first month in, our CMO called each one of us individually to give us like a pep talk and
Oh my
to
God, that's
like
really sweet.
get us ready for like pandemic mode. And it was
Wait,
teaching
so
us.
the one, sorry, not to give it specific names, but the CMO that we all had
Yeah.
that is now not there anymore. Oh my
Yes.
God. That
It
must have
was
been really
lovely.
sweet. Yeah.
I loved it. Like it was a very supportive conversation,
Oh,
and it was
he's really good at that.
and it was asking, okay, like this was the height of things, and we shut down, we went to full telehealth, and he was like, what are you going to send someone to the health center for? And the correct answer there was nothing, right? Because you were weighing the risk of somebody getting COVID and potentially dying,
Yes.
right?
Oh my
And so what a
gosh.
beautiful, like what a teaching moment of also realizing what is important and to remind yourself, like, I am ordering something that is going to impact our decision and it's going to impact someone's life. Because I feel like for me, especially, I didn't know really what to order in the beginning, or I was going to do a CBC for everybody. And I was going to do a CBC with diff for everybody. And why not a TSH? And then, hey, let's do that, right?
Totally.
No.
Throw in a dip.
Like, right? Just dip it. Okay. Yeah. So I feel like COVID has done so many things, but that's something that it was, for me, really helpful at recentering on like what's most important is what you're here with the patient for, right? And you're following guidelines and doing the screenings, yes, but we're not looking for things that aren't there, right? And helping to go back to standards of care. And also, like, COVID for me was beautiful, like calling people at their homes, right?
I know. I feel like that's such your speed. Like, it's so
it
like
was so cool. Yeah. Like
that.
hearing you, Heather, like doing house calls, like I had not had that experience before. And I have so many people where I get to care for their whole family. So I was calling people and I was hearing multiple patients in the background. And it was so cool. And like it really made me like, I feel like for many of us, right, it was disorienting, and life is freaking disorienting in general, and also brought me back to the mindfulness of what am I here for? And I'm here for connection, and it helped me get to do that and also think about what matters. And what matters is like, hey, you're here for somebody else and you're facilitating health. And so to me, it feels good, but it's hard for me to know if disorientation is because I got kids, right? I'm going to start a new job.
I haven't slept in
still
years.
Like word, right? Maybe it's that, or like, there's just like genocide, right? There's that too, right? Like, there's so many
just coming at you from every angle.
Jesus, right? But like, Jesus, like, I don't know, right? So I think being an NP, like, just you be yourself and you be yourself with other people. And I feel like that is the most healing, is giving space for people to be themselves. And COVID, you got to be there for people when it was like a really vulnerable, scary time. And that was such a great teacher for trauma-informed care and how to show up for people.
Yeah.
Kara, you need a podcast.
I mean,
I feel like I'm so wise. I'm just like, talking.
I went a lot of places there.
I love it.
Unclear, but main thing is like we want to be ourselves. And I feel like for me, especially when I first started, like I didn't really know how to be myself, because like y'all had like experience like in like nursing too, and that wasn't, I had experience as like a health counselor at a school-based self center. So like I love my sexual health experience, and that's where I came from, but I didn't have that like bedside nursing or like even like med surge stuff. So I felt like major imposter syndrome of like, okay, you went to the school, but you have not really done this. So, right. But that people just want you to be there and to listen, and then you look the things up. It's all good.
It's so true. And I want to say, Kara, too, that like when I remember, because wait, Heather, I'm totally blanking. What were you, master's entry, or did you work on the floor? You were master's entry.
No, but I worked because my program was part-time. So I worked.
I see.
During my program. Yeah.
Well, I was going to say, I just feel like both you, like, I just to really validate for you, but also for other new grads out there. I was a nurse for about 6 years. And like, I feel like there was something that the thing that I felt really happy with, having had that experience was that I think the challenge that I think that a lot of new grads have, especially like if you haven't been in the hospital setting before, is like seeing the acuity and recognizing and like having that kind of like visceral kind of like, oh, that person's sick. Like you can look at them and be like sick, even if you don't know what it is. And so I felt like for me, that really helped me coming in. But honestly, I was just so impressed with both of you. I was like, I'm just such a crier. I'm going to try not to cry, but I was just so impressed with both of you, like how much you knew and how good you were. And I was just like, wow, they're like amazing. And I feel like it makes me so angry when people just like hate on like master's entry versus traditional entry, like whatever. Like there are some challenges that I feel like I had a lot of empathy and compassion for you both, because I felt like I would have had a much harder time if I didn't have that experience, but you know, just flew. I mean, I remember one time, Kara. I mean, I remember one time.
Did we have a choice though?
What?
Did we have a choice?
It's so true. It's so true. Well, yeah, Heather, what do you want to chime in for the new grads?
I totally agree with like the labs. So don't go looking for something.
Yeah.
And a lot of times it's like your own insecurity. Like, I don't want to miss something, so I'm just going to check everything. But you're not necessarily helping the patient out by doing that. And I think just listening to what they want and need and kind of going in that direction instead of sort of hearing your own dialogue and saying, okay, I just have to make sure it's none of these 20 things, because likely it's not. And
that's so hard though.
The other thing is the follow-up. So that was one thing, like I was working with one of my providers with a lot, was just follow up in 2 weeks. If you need to like check on something else, follow up in 1 month, follow up next week. If you feel like it's urgent, but it doesn't need to be addressed today. Like you don't have to address everything in that one visit.
That's so hard.
It can become so overwhelming for the provider if you're like trying to touch on everything they say and you want to make sure you get everything right. Just prioritizing like, what do we need to do today and what can we revisit next week?
Yeah. And that perspective, excuse me, that perspective can be really tough too. Cause like, I remember being like, yeah, should I write down that like toe tingling problem? Like we're gonna like, I think it's okay, like, but should I add it to my problem list of like 27?
Do I need to add it?
What if it's really serious in 6 months? It's like, okay, well, it's gonna keep getting worse. Like it's okay. It's okay. Oh, I love that. It feels to me like things are really different. And it's funny because I'm trying to like talk like myself and I swear a lot more in person than I do on the podcast and I'm like catching myself. Yeah, just like things are so different. So you feel like things like, I guess before it was kind of this, at least for me, it was like, you know, hustle grind. Here's the way the medicine is. Here we go. And it just feels to me, especially with real world NP, like just as an example, like we would do these Friday wins. I haven't been on social media as much lately, this whole year actually, but we used to do this thing about sharing wins inspired by another company that did something similar. But people would share things that are really concrete about like, oh, like I passed my boards, I got a job, and people still share that, which is great. But I think the shares that I'm noticing that makes me so happy is like those self-honoring choices of like, I left a toxic workplace. I have more things to do, but I decided to be done for the day because it's Friday night and I want to chill. So yeah, does that strike you as like, that's what's happening out there in the real world? Like in what you've seen and what you've experienced? Like, I don't know, like we had those gifts of COVID, as much as it's been terrible, but like, yeah,
I don't know, showed us like work-life balance, although there was like no work-life balance during COVID. I think it showed us what it was like to be home with your family more, and that working from home is possible in healthcare in general. When we went back, we still had a telehealth day, right? So like when we went back after COVID, we still had a telehealth day, we still had a remote day. And me personally, after my first kid, I had to cut my hours back because I was like, there's no way I can sustain like working this many hours, seeing this many patients, and raising a family.
Mm-hmm.
And then from there, I think it was during COVID that we got promoted to associate medical director. Right.
Mm-hmm.
And so that gives you a little more admin time and a little more balance between patient care and admin time. And it just helps with burnout so much. Like, whether it's cutting back hours or throwing in some telehealth or finding a way to get more admin time, taking on projects, like anything like that can help to prevent burnout. At least for me, it did. And I think it does for the most part across the board, because patient facing care and seeing patients is like really, really where I find burnout.
Yeah.
And it's like the most important role, right?
Yes.
But if you're doing it, you're seeing 16 patients a day, 5 days a week, like you can't.
Yeah. Yeah. And also like depending on like, and the more complications you add too, because I definitely like talk to people in the community, and it's like, it's such a wild range of what people are seeing, whether it's like 16 a day, 20 a day. I mean, there's 30 people a day.
Urgent care, they're doing like 30 a day. Yeah.
Yeah. I mean, I really hope that that's going down. It's all anecdotal, right? Like I don't have any actual stats, but and then what were you going to say, Kara?
I think, well, hearing you talk, Heather, like we went through this like crucial like point at the health center where I think it was like 15 people who left, and we are not a big health center.
Hold on, 15 providers or all staff or
within a year,
mainly NPs, and it was awful. And
that's so bad.
It makes me sad that we didn't make the changes for sustainability before, because those were lovely people. And that did kind of force the organization to deal with it. And I think they would have anyways, right? But that puts you in a position where you can't see patients, right? Like there's not people to do that, right? And we really were able to shift, like we were doing on call, but that was part of the contract and you weren't necessarily getting paid for that. You were doing Saturdays, was part of the contract, not getting paid. It was like kind of like you weren't having the telehealth day. Like it was all like being shifted. And we didn't have like the resources we needed. So people left, and then we changed how we paid people, and now we pay well.
I was going to say, what are some of the sustainable changes? Because I think it's really helpful for people to hear, because I don't think people are doing this as often now, hopefully, but people have this feeling of obligation that they need to stay in toxic workplaces. Not saying that where we worked was a toxic place, but I think it's really helpful for people to hear that.
Then for like periods of time.
Yeah, there were some periods of
changing.
But like when people leave, like that's going to help the organization shift. Like you staying in a toxic workplace does not help things change necessarily. But go ahead.
Totally. Yeah. So we started to make like small changes, but it wasn't quite fast enough, which I think is the hard part of institutions. And we hired 2 remote on-call people who do on-call as their main job. And we took away Saturdays, and that was extra pay. So no more Saturdays, no more on-call. And if you do them, you get paid. And
huge.
Yeah, we pivoted.
Companies already took away call. So that was like a big thing that had people leaving.
Was the on-call schedule?
Yeah. I mean, you could find places that were outsourcing call. So that was a big thing for some people, was not having to do call.
Yeah. I mean, that makes a big difference. Was it a contracted company, or was it in-house employees that did the call?
In-house.
That's interesting. And I just wanted to offer that.
The other organizations were contracted out.
The other ones.
Yes.
Okay. So it was an on-call group. Okay. Because I was going to say, so the thing that I just love talking about that, because I think it's nice for people to know, because so many new grads are in this like isolated position where they don't even know what's available. Like all they have, and I bet you felt the same way of like when you entered an organization, or like, oh, this is just how things are. But hopefully, like fingers crossed, things are changing. But the last health center that I worked at, that was not where we all worked at. They had a company that had a call service that went through a nursing triage first, and then they had all these protocols, and then they got to you. And so we still had on call, but it was like mind blowing. Like I had somebody with an INR or something that was super high. Was it an INR? I can't remember, but it was some sort of, I think I had to do some warfarin adjustment. And it was just like, here's the thing. Here are all the questions that you would have asked me. It was just like, bam, like presented for me. And I was like, this is amazing. I just had to do, she's like, here's the suggestion of, do you want to do this or this or this or this? And I was like, oh, yes, that please. Okay, I'm going to go back to sleep now. Bye.
To new grads that you can make change. You can leave if change is not being made.
Yeah.
But you can also push and, keep advocating, and eventually, maybe slowly, but there was a lot of change in the past few years that ended up being positive change. And it did take people leaving, and it did take us voicing a lot of opinions, but changes were ultimately made, and for the better. And I think in the long run for the company, they will be able to retain employees.
So it definitely sounds like there's like a both and there of like, you get to, if you feel fully resourced and capable of staying, beautiful, and you don't have to stay. You're not abandoning anybody. Like there will always be providers. There will always be patients. What are some of the changes that you felt like you've been happy about, Heather, in the last couple of years? Like, what do you feel like are some of those changes? I think that people would love to know kind of like what was going on, and maybe like what you advocated for and how you advocated for it. If you feel like sharing.
Was one of the big ones.
Yeah.
So we got to the point where we were like having to tell people that everyone at the end of their call week wants to quit. Like that's how people are feeling.
Wow.
People were calling out on their last day of call or the day after call. And we had to like present it just very real to our leadership that our employees shouldn't feel like they have to call out. They shouldn't have to take a sick day. They shouldn't have to request a vacation day the day after their call week because they are so burnt out from being on call. And so they trialed a few different things, right? Like they were doing, maybe you don't have clinic the week you're on call, and then they gave us the Monday after call off. And so they trialed a few things, and some of it was just not sustainable financially. And eventually we came to, leadership came to this plan where they hired 2 people to rotate call weeks. And it's a huge change to not have to take that on as a primary care provider.
I mean, if you just like look at it on paper, it's like, okay, you're supposed to function all day long, making really important, challenging decisions and holding so much. And then you're supposed to go home and have a life and answer more questions all night long.
Right. And
that's not sustainable.
One thing COVID did was like change what call was, because we had access, patients had access by phone 24/7 to the clinic. And we had people doing telehealth on Saturdays and Sundays and late nights more frequently. So patients were calling us 24/7. Like you would get over, I think, 100 calls in a week on call.
What?
That was through COVID because it was just high anxiety. Anything came up, they would call.
Yeah.
And it never, ever went back to the way it was pre-COVID. It was never like 9 calls this weekend. It was like 25.
Yeah. Wow.
So, yeah.
Wow. That's so much.
Yeah, hearing you say data, like Liz, whenever I talk to anyone in leadership, right, that's the question they come back to. Like, show me the data, right? Because I'm happy to show you all my emotions and to relay all my emotions for how the other people feel, right? I can access that. And I've learned now to show the data, exactly what Heather said, right? You look at the number of call outs that happen the day after, the number of people that are planning days off. You look at the data for how many calls you get. And we also made a shift and moved away from 15-minute visits. And that's huge.
What did you move to?
We now do 20/30s. 30s is just physicals or when somebody is requesting that time, when someone needs the time, which is really nice. that is huge. And it's also helpful to ask your organization, like, what is the bottom line? What is your goal for a PCP to see a day? And also, what is the minimum, right? Like, what
Yes.
are we needing to
Yeah.
support the health center?
Totally.
I was surprised to learn that about our organization, that it is not nearly as high as I thought it was.
For the bare minimum, you mean?
Oh yeah, the bare minimum's like 12 and an 8-hour shift. Like, so knowledge is power, right?
Yes.
Like, so
Yes.
cliche, right? But knowing
Yes.
that and being able to make your decisions, it does not mean you can't just schedule 12 patients. You have to schedule more to
Yes.
allow
No
for the
shows
things
and
that shift, right?
yeah.
But knowing those things and knowing also what makes people happy at their job. You
Yeah.
want people to be
Yeah.
happy.
Yes. Yes.
And that is crucial, right? People leave because you're doing too much. That is very, very consistent across the board. So us making that shift is huge. I got to interview someone yesterday, and she just came from seeing 22 patients at a community health center. And I got to say with confidence, like, you will not do that here. We are not going back to 15-minute visits. Like, that is like not happening. And so I feel like we are in an excellent place for sustainability to build. And I'm feeling hopeful. Like, we have a lot of work to still do, right? But not having 15-minute visits anymore is huge. Not expecting people to see 20 patients is huge.
And increasing salaries.
Yeah.
That's the other thing that, like, we had people leaving to go places they didn't necessarily even want to work, but they could just make
100%
that much more money.
100%.
That for them financially and their family, it made sense. And we had a good handful of people do that.
Oh,
they all went to the same place because they knew what they could make. And
it's so true. It's so true. We lost my last health center. We lost this is more other staff, but I remember one shift we had one medical assistant for 5 providers because they all went to this one facility that made several dollars more an hour to do way less work. Not a federally qualified health center. It was a big hospital. They had to do a lot less and they worked really, really, really hard. So yeah, it's really important. I love that you say that, care about the data. It's like, I think it's so, I just remember being a new grad and not knowing any of this, of how healthcare works and the business of primary care. I made a couple episodes for the channel about it, and I think it's on the podcast, so I can link, I'll share those with the people when they're listening, but it's so helpful to know those pieces. And like, I think for like another takeaway for whether you're a new grads or people coming into practice is like, what is your criteria of satisfaction? What are you independent of this clinic setting or whatever clinic setting? Like, what are the things that you need to make you happy? Right. Because for some people, they don't mind call. For some people, they don't mind, like whatever the things are. And is it about the money? Because obviously we need to pay our bills and we need to have the life, that we want to have. And it may not always be the money. It could be the money and it could be stuff. It could be, do you know what I mean? Like,
yeah,
I love hearing you share about all of those different pieces that are available.
Yeah.
Oh my gosh. I could talk to y'all forever. And I mean, we can talk about this separately, but I'd love to have you come back. Just roundtable chats for the people. But thank you so much. Go ahead.
Any funny patients?
Yeah, we have a few more minutes. So yeah, just like some funny stuff, like any favorite story. I'm trying to think of stories, and all of mine are like kind of traumatizing, but it's like tragic comedy. You know what I mean? I think y'all were there. I mean, I think my stories of like, yeah, there's a lot happened in that clinic. It was a wild place, especially like, I don't know. I mean, y'all did trainings at other clinics, but I went to another clinic and I was like, they are not as sick. It is wild. It was
wow.
Yeah. Like they're like 20 to 50, healthy, recently emigrated, have a lot of mental health and trauma. Like that's, but I'm comfortable in that space, but like, not like, hey, I'm sending you to the hospital because content warning, your blackened toe is sticking out of your foot on a Saturday urgent care, or like bone rather. But yeah, so sorry. I'm not sure. But these are like the tragic comedy stories that I can think of. And I was like, yeah, remember that? I mean, yeah, I wish, oh my God, you know who I should bring on? I feel like I should bring Melissa on.
Oh yeah.
All three of us plus Melissa. Like how many fun stories.
Great.
She's such
That
a
would be
character.
great.
She was the nurse that worked with us. But yeah, funny stories. Any funny stories, any light stories? I think we wrote like 10 minutes and I think I gotta let you all go. But what do you think? Any recent things or new grad things or I don't know if the world's ready for my gruesome
I know.
Your gruesome
I
toe.
definitely
Yeah.
have some
the
like
gruesome toe and drain that was
gross,
left
like-
in from the hospitalization. Can you just take out this? I'm like, no, I don't even know what that drain is. Your groin. No, leave. I love you and leave.
Were you gonna say a story, Heather?
No, I'm trying to like think back, but I was hoping you guys would have some that would like jog my memory.
Well, do y'all remember that?
Yeah.
Do you remember that gentleman? Oh, sorry. Do you have a story, Kara? Because I can just riff, but
I mean, like last week, sent someone to the hospital, which never do lightly.
yes.
His potassium was 2.5, and having some EKG changes.
Wow.
He's drinking a whole lot, which is likely what's causing the low potassium. And we just had this lovely moment where he's like, and we speak in Spanish together. He's kind of like, "Thank you for sending me, and I hate you." Right? Like, which I so appreciated that we like just leaving it like that, right?
Yeah.
Like,
I love
very
that.
endearing.
I feel like you've got such great rapport with all of your patients, Kara. They just like adore you.
It's amazing because I got to inherit them from somebody else who they adored. So I got to maintain the adoring, right?
Yes.
I know. You were the
Amazing.
perfect person to take over that panel.
Well, speaking of that person that I got to take their
that
panel, I had to help discharge a patient for my first time. That was last month. And this
I've had that
patient
experience.
knew it was going down, knew that was happening because we kind of like, we set our boundaries, and for years we've kind of just kept pushing him to the side. And this time we're like, no, we need to do this and we're going to have a talk about it. She knew it was happening. And when I walked into the room, she had a very large cross that she had on the exam table.
Do I know this person? Is
Yes,
this
you do.
I think I can
Yes.
see her in my mind. Yes.
Yes,
I'm pretty sure I can see her. Yep.
She had a like cross on the table, ready to kind of like just give me the word, right? And as I'm saying, like yes, this is happening, right? We're gonna find another primary care for you. Held up the cross like to my face, right? And that was
like hopefully not in a threatening way.
Wanted to spread some curse or something, right? And
Oh,
this is
boy.
probably not a fabulous funny story, so we can maybe take this one out, right? But like having to tell somebody like, oh, no, not today. Nope. You're gonna put that down, and we're gonna bring it back.
Oh my gosh. You know what? That's the thing I feel like about healthcare humor is that like there's the tragic comedy is like the thing. It's like if you don't laugh, you're like, how can you handle something like that? Like a cross being held up to your face, being like,
I can share what brought me to healthcare was team-based care, and this will always stay with me. I got to call somebody with their negative like STI screening results, and they're on the phone and they scream, "I'm a beast!" I was like, yeah.
Oh, that is great.
oh my God, I love that so much.
Yeah. I was like, that's what we want.
Sexual health is one of my favorite topics because it's just gets to be so fun. I mean, I know it's not comfortable for everybody, but like, you know, you and I, Kara, love that stuff. It just adds so much levity to some really heavy stuff sometimes. Love that. Does that jog any memories for you? Sorry, go ahead.
Well, I suggested funny stories, right?
Yeah.
And then I realized I don't have really any funny stories, so I made a mistake. Like I have a fun time, right?
Like, and it's like funny when we're talking about these stories that are not funny.
Yes.
Like some of these are like scary.
Yeah.
And we're looking back and I'm like, I remember like someone coming at me, literally like calling me the C word and telling me they were going to punch me in the face. And
yikes.
And, like, I don't even remember who had to step in, but like, we know the patient well, and we sort of expect it, right?
Yeah.
Like, you know, this is going to happen and it can be scary. And a week later, it can be something we're sort of laughing at. So,
oh, I know.
Yeah, we've had some, I think like, someone threw a cane at someone, and no one got hurt,
Nice.
so it wouldn't be fair if anyone got hurt. But when you get to know these patients, it's like, you know, this is what's going to come of it. And so as long as you're prepared, it can be a little entertaining after the fact.
Yeah.
As long as everyone comes out unscathed.
It's so true.
Yeah.
Oh, geez.
Oh my gosh.
But I feel like the funny stories are more like, we're like trauma bonding.
Do you remember, I'm not going to name any names, but there was a patient who had really severe diabetes, ended up having heart failure. Real talker, was like not obsessed with me, but like he was like, I feel like he and I had the rapport. This was like at the very beginning. I don't know if y'all remember this.
Yeah.
Well,
I wish I could give more details.
definitely some people who were obsessed with you.
Big fans. Yes. But this gentleman, it was like you couldn't get a word in edgewise, but like we graduated to the point where it was like, because it felt like he just like straight up talked for like 45 minutes, and I would be like, can I, you know, but then anyway, but one time, this must have been I feel like this maybe was a Saturday, but I think the person whose panel you inherited was still there.
Yeah.
Kara, and that we all worked with, that I called mom accidentally.
She inherited all of us, or like acquired all of us.
And she, of course, is like the amazing gem of a human. It was just like,
yes.
yeah, no, I'm not your mom. But I remember one time this is when I was a newer grad, and I was still like a little bit nervous, and I went into the room, and he was basically like, so I like stubbed my toe walking. So the place that we worked like had a lot of cobblestone streets, and was like, you know, I stubbed my toe on the cobblestones, and like, I think it's okay. Like, it's, you know, it's like not a big deal, but I'd love for you to just take a look at it. This is like a doorknob question, like at the end of the visit. And like, we were talking about so many things, and I don't know, maybe I intended to do a foot exam anyway, whatever. But he, took off his shoes and his socks, and the smell filled the entire, health center. And I was like, can you give me a second? Because it was basically like, oh my God, bone infection, osteomyelitis. Like it was like almost like near, like no chance it couldn't have been that. But I was a new grad, and I'd never seen like new diagnosis of osteomyelitis. And so I like walked down the hall, and I got her, and I was like, do you look at this? Because I'm not really sure what I should do. Like thinking about antibiotics. And thank you so much. Well, we're going to take a second. We're going to step out. And we walked out, and she's like, you need to send him to the hospital. And I was like, oh, okay. I was so nervous because I was a new grad, and I was just like, do I send him to the hospital for IV antibiotics? Can we get away with it? And now that I've experienced, I'm like, oh, duh. Like, of course, someone with like heart failure, complicated diabetes, and renal impairment, like he ended up having an amputation. He had an IV amputation, and he had like a smash in his kidney function because he had to have all that treatment done. But like, I don't know. I mean, it's like, again, like that's like not funny that happened to that person, but like the humor is in the like asking mom to take a look and make sure I wasn't
what you should do with that.
I mean, she's such a mom though, right? Did y'all ever call her mom?
I did.
Am I the only one?
Definitely
never did on like.
No. She's definitely mom-like.
It was like that teacher moment, you know, when you go to school as a kid, and then you're like, you call your mom. Yeah, you call your teacher mom. It was one of those. It was charming, but yeah.
I did have to remove a tampon that was in for at least a week, I think, when I was like 7 months pregnant.
Oh no!
And I remember like just having to run out of the room immediately so I wouldn't throw up. But like, it's like, okay, I got this. I'm gonna do this, and then I have to leave the room immediately.
Yeah.
And I don't remember like if I don't think I did throw up in that, but I have a very vivid memory of like, this was not good. This was not going to end well for me.
Oh my God. So that first time that I had that happen, I was with Melissa, the nurse that we worked with. And I must have been an urgent care day, because I think it was just her and I. But yeah, so like I hadn't done that before, and I was like, oh, I think that's what's happening. And she was like, you need to take that out immediately. Like it's like, what is that? The procedure, you kind of like use the forceps, and then you kind of pull, and then you put it in the gloves immediately, and then you put it in the trash. She like took the trash and ran with it.
Yes.
Outside, because it was so intense. The patient was so mortified, and I just like, I felt I was like trying my best to like have her feel comfortable, because like how mortifying, you know, but yeah, it was Yeah,
I remember your face, Liz. Like, so I got to do my IUD training with Liz. And after I got trained, then I had to do a couple where I had you come in to
yeah,
just
yeah,
like
yeah.
make sure, hey, I got this. I remember going down the hall and it was somebody who was 18 for like their IUD. And I remember looking at you and you like made this face like, this is not going to really be so quick. Cause I was just like 2 seconds, come on in, watch me do this, cross it off. And your face was like, okay. And I was like, what do you mean? It's going to be fine. And
Oh my God.
it was, but I remember your face in that moment being like, I don't know if she really, yeah. Yeah.
Oh my God. And so many, I was thinking of you, Kara, because in my last clinic, I did, so Kara and I did a bunch of women's health procedure or gynecological contraceptive procedures. And yeah, I just remember so many Nexplanon removals. We would tag team of
Remember
like,
when we
I
didn't
can't get it.
have
I can't get it.
Epi? We didn't have lidocaine with Epi. Like I remember coming back from maternity or something and it was like a shortage. And so we had to do Nexplanon removals without Epi.
Yeah. And it would just a gush.
So,
It would just
so much blood.
like,
Like,
this is egregious. This is
it
really,
is.
really
It really was.
unnecessary.
And I remember like I was happy that we both were doing that together because I'm like,
Yeah.
we're doing this. We're not going to make someone come back for this.
Yeah.
But it was a lot. It was a lot of fluids.
my
I used so much gauze.
So much gauze. My second clinic that I just worked at, they didn't use Epi. They didn't use Lido with Epi. I was like, how have you ever removed an Nexplanon without that? It was wild.
Whoa.
It was like very novel to introduce, but
Okay.
oh my God.
Maybe I'll try again now that I have more experience. But back then I was like, whoa.
No, thank you. No. I was like, we're going to use the Epi. We have Epi. Why would we not use that?
Yes.
Oh my gosh. This has me really wanting to work at the same clinic again. Like oh my gosh. So fun. I could keep you here all day. Do you have any other anecdotes you want to share? Should we wrap up and maybe like, I could do this. I could do this all the time. I don't know. Any thoughts, any parting thoughts for now to be continued? Again, new grads, like I think the main people, from what I understand, it seems all across the board, but we're really like new grads, people entering primary care from a specialty.
The other thing is like, know what you don't know and ask for help. Like,
and don't feel bad about it. I mean, it's hard not to.
Don't feel bad about it. Yeah. Everyone you're working with is probably potentially going to follow up with that patient or maybe see them in the future. Like, don't feel bad about asking for help. And if you feel like you don't know something, either look it up the longer way or ask for help or follow up with the patient, like short-term follow-up if you're not 100% sure.
Totally. And that zoomed out perspective too is so hard at least for me, it was so hard to have. But it's like, take a beat and it's like, okay, if you don't get the monofilament test done today for this diabetes, it's probably okay to do it in 3 weeks.
The things I like don't do now that would have terrified me before, right? The things that I'm just like, people ask them, I'm like, no, it's okay.
Yeah.
Right?
Okay,
we're
good.
We're all not set. A priority, sorry.
Yeah. I went for a lot of walks, like the first month, especially of practice, because I wasn't expecting the mental exhaustion for myself. So like as you enter, if that's something, right, for me, like just making space where I kind of like shut down everything else, where I didn't like overplan things, but just getting to like be outside after like seeing patients was helpful for me. Because even just a new job can be exhausting, even if you've been in this game for a long time,
Absolutely.
like it's just like
there's so much to
listen
adjust
to
to.
EMRs.
What'd you say?
EMRs.
But I totally felt that about the exhaustion. Like I remember in grad school, and again, like everyone's coping and physical abilities are different. And I feel like for me, like we would go to class like all day. My brain would be like throbbing, trying to remember things. And then I would get on the treadmill and I'd be like, wow, I feel so much better. Like I was like, I don't know what physiologically is happening, but I feel like I've just like drained all the lactic acid out of my brain or something. I don't know if that's actually accurate. Don't quote me on that. But yeah, just some sort of
a
like
PCP is like, or just an NP, especially in primary care, like the questions don't stop. You get home and a family member calls you, or a friend calls you, or your husband's
totally.
sick, or
Totally.
I feel like it comes at all angles, all those medical questions.
It's so true. Well, thank you so much. This is amazing. And I love you both so dearly. And I'm so grateful to share your beautiful spirits with the world. And I bet the people are going to be like, bring them back, bring that back. We'll see. We'll see. To be continued. But
Thank you for having us, Liz. This was lovely.
Thank you.
So good to see your faces and chat.
Totally.